Welcome, everyone. We are thrilled that you're all joining us this evening. My name is Melinda St. Louis, and I direct Public Citizens Medicare for All campaign. I'm thrilled to welcome you to this exciting Medicare for All Resolutions Coalition webinar tonight. You know, when we scheduled tonight's webinar, we didn't know that we would be in the middle of one of the biggest showdowns on Capitol Hill in recent memory related to the sweeping Build Back Better budget package that is hanging in the balance. Many progressive organizations and our champions in Congress have been working tirelessly over recent months to ensure that this $3.5 trillion budget package includes a host of progressive priorities, including to improve and expand Medicare, all the while continuing to build the base for Medicare for All. And as we know, the Delta variant continues to devastate communities and is tragically continues to make the case for why we desperately need guaranteed health care for all. So tonight we're going to focus on continuing our fight for Medicare for All in the current context. We're extremely honored to have with us tonight Representative Pramila Jayapal, who, as you all know, is the author of the Medicare for All Act of 2021. She is also the chair of the Congressional Progressive Caucus and is right in the thick of all of the machinations that are happening in Washington right now. So we couldn't be more grateful that she's taking some minutes out of what I'm sure is going to be a very long night, out of a very long week, to share her strategic insights on how we build Medicare for All, recognizing that our grassroots movement building is as critically important as a lot of the inside baseball that's happening on Capitol Hill right now. We also will get to hear from local leaders from around the country who have been successful in doing that local base building and that we're going to need to win guaranteed health care for all. We'll have a council member from Highland Park, New Jersey, close partners from Texas Organizing Project, Spaces in Action in DC, and we'll celebrate and learn from many of our Medicare for All resolutions, local organizing victories. So because we're a large meeting tonight, only our speakers can unmute themselves, but please feel free to share any questions or comments in the chat. And we'll do our best to answer them, or we'll follow up with you afterwards. We really want you to be a part of this ongoing conversation. So let's jump right in and hear from our champion, Representative Pramila Jayapal from Washington's 7th Congressional District and chair of the Congressional Progressive Caucus. Welcome, and please share with us your insight about this moment and how we can help build support for Medicare for All in the coming months. Thank you.
Melinda, thank you so much. Thank you to you for your leadership and to Public Citizen and the entire coalition of activists and advocates and organizations that have been driving this debate for universal health care as a human right. I could not be more grateful to you. And as I said to Melinda before we got started, she said, I can't believe you're here with us in the midst of everything that's going on. And I said, you know how important this issue is to me. And that's really true. I would not, there's nothing else I would be doing, frankly, given everything else that's on our plate right now. But this is really important. And this movement is really, really important. And so I am really excited to discuss with you kind of where we are and what have been our recent efforts, what's our ongoing fight for Medicare for All. Because of you and all the dedicated organizers working alongside us, we introduced the Medicare for All Act of 2021 alongside more than half of the House Democratic Caucus, including 14 powerful committee chairs. Remember that the last time we did the Medicare for All Act, we only got to half of the caucus at the end, long after introduction. We had to keep working and building, but that wasn't the case this time. We actually started with half of the Democratic Caucus. We have the backing of more than 300 local, state, and national organizations and the grassroots support of millions across the country. Our legislation lays out a detailed plan. And this is important because until I introduced the Medicare for All bill into the House, not this session, but the last session, there actually wasn't a detailed Medicare for All bill in the House. There had been a resolution, which was very important, but there wasn't a detailed plan on how to transform the broken for-profit healthcare system into one that guarantees healthcare as a human right for everyone. And when we say everyone, we mean everyone, regardless of income or employment status or zip code or race or immigration status. Because when we say that healthcare is a human right, we don't just mean that people should have some level of coverage. We actually mean comprehensive benefits with dental, vision, mental health, reproductive health, and long-term support services. Benefits that people need if we're going to live our lives with dignity, and all without copays, private insurance premiums, deductibles, and other cost sharing. Now, our introduction was successful because of the foundation we laid last Congress. Together, we held 4 congressional hearings on Medicare for All. Those were the first ever in the history of Congress. And I think most of you understand that if you're going to make a major legislative change in Congress, you have to build a legislative history. You have to have testimony, you have to bring in experts, you have to get everybody on board. And that's what we were finally able to get, is these hearings in the 4 committees of jurisdiction for Medicare for All. And together, we brought Medicare for All into the mainstream and of course made it the focal point of the Democratic presidential primary. Now, in the midst of a pandemic, the case for Medicare for All became and is clearer than it ever was before. Every other industrialized country realized long ago that you simply cannot tether healthcare to employment, and that healthcare has to be guaranteed to everyone in order to have a thriving society. And yet, in the United States of America, the richest country in the world, as the deadly COVID-19 pandemic caused people to lose their jobs, cruelly, at least 27 million also lost their healthcare. And while Medicare for All alone could not have addressed all the barriers and challenges brought forth by the COVID-19 pandemic, it is undeniable that it would have largely strengthened our response and further enabled everyone to seek necessary services with the health security that they deserve. And that is just a lesson that we have to remember as we deliver relief to families across America. And that's why we've been fighting to at least get significant portions of what I was able to negotiate as co-chair of the Biden-Sanders Unity Task Force last year into this Build Back Better package. Now, many of us supported a candidate who ran on Medicare for All, and that candidate didn't win, but we did get the conversation expanded dramatically to talk about how do we expand Medicare. As many of you know, I led more than 70% of the House Democratic Caucus, from progressives and moderates to 15 frontliners, running in the toughest races across the country in urging the president to deliver on his campaign promise and to improve and expand Medicare and to crack down on big pharma's price gouging. We can pay for Medicare expansion by finally taking on the greed of the pharmaceutical industry and demanding that big pharma stop ripping off US taxpayers by charging us the highest prices in the world for prescription drugs. And if we allow Medicare to negotiate and set drug prices, the Congressional Budget Office estimates that we're going to save taxpayers at least $456 billion over the next decade. With those savings, we can finally make drug prices affordable for all Americans and expand the benefits that Medicare provides to include dental, vision, and hearing, and expand the number of people that are covered by Medicare. Now, all of these are not Medicare for all. These are not the steps that get us to Medicare for all right in this moment. But what we do need to do is, first of all, show people that we are on the track to doing Medicare for all as a whole. And the more people we bring into Medicare, the more we expand those Medicare benefits, the better that will be for our organizing. But on top of that, we need to do the continued work of building the coalition across the country. And what I hear from my colleagues all the time is our inside-outside strategy on Medicare for All is working. We work with our colleagues to explain what's in the bill, to answer their questions, and then they hear from you, activists around the country who have passed resolutions in your cities and counties and states to say we need Medicare for all. They hear from you in their districts and they change their mind about whether or not they should get on Medicare for all. And these resolutions are one of the best possible ways to engage in building the movement from the grassroots up. Progressives, moderates, and members from the most competitive districts have been getting on to the Medicare for All bill. They understand that constituents need healthcare in the midst of a pandemic and that it is really, really important. Our efforts in the Build Back Better Act to actually, oops, that's one of the TV stations calling me, to actually be able to deliver on these Medicare improvements as a stepping stone on the way to Medicare for All is getting us one step closer to our vision. So once we are able to show that in cities across the country, we have this grassroots movement that is absolutely accelerating our progress and helping people to understand how important this is to you with your personal stories, with your organizing, and with your advocacy, we will be able to deliver. That's Chris Hayes calling because I'm supposed to be on NBC right now. I'm so sorry, Melinda, but
I think you need to do that. So,
but let me just say thank you. That's really, before they call me again and I have to get off, let me just say thank you. You all are awesome. Keep fighting. We're going to get this done. And ultimately, we are going to deliver healthcare for every single American as a human right. Thank you all so much.
thank you for all you're doing and all your leadership. Thank you.
Bye.
Okay, take care. So I obviously, I wanted to gush a little bit more with her, but obviously she needed to go. So we're really grateful to her and to her staff for making the time at this extremely critical juncture to join us. So now I'm really thrilled to welcome one of our local municipal leaders who is helping to build the grassroots base that she talked about. I'm excited to welcome Councilmember Matt Hersh from Highland Park, New Jersey, who championed a successful Medicare All resolution in July, which is in a really exciting congressional district, the chairman of the Energy and Commerce Committee, Frank Pallone. So thank you so much for joining us, Councilmember Hersh.
Thank you so much, Melinda. And I'm also expecting Chris Hayes to call me. So I don't think I don't think that's happening. But I'm really grateful to be here, and thank you so much for the opportunity to highlight not the work of my leadership or my leadership, but really the work of the Grassroots Coalition that approached the Highland Park Council to really get the ball rolling on passing a Medicare for All resolution. I just wanted to really give a special thanks to Public Citizen and Our Revolution, Middlesex County here in New Jersey, Anna Margovisky, and the whole crew, because the work of municipal government, regardless of how progressive you are, can often kind of co-opt some of the big picture things that we need to keep our eye on when it comes to our advocacy. And one of the things that I really try to remember serving in local government is that a very powerful tool that local governments can do is advocate for large federal issues, and particularly issues that will benefit our constituency and hopefully create a more stable future. By day, I'm an affordable housing advocate, so healthy communities are really integral to. We've in the last few years we've really seen kind of a cross-pollination of policies when it comes to housing and healthcare, when it comes to healthy homes and communities. I mean, it's all interrelated, and I know I'm preaching to the choir here, but it was really important, I think, for Little Highland Park to take a stand on HR 1976 because, well, first we have three members of our congressional delegation in New Jersey who are co-sponsors of this bill, Representatives Payne, Watson Coleman, and our representative here in the 6th District, Frank Pallone, who chairs the Energy and Commerce Committee. Representative Pallone came to the table eventually, but it's really important, we thought, to make sure that he hears our voice from a strong core constituency of his district, but also to set an example for other municipalities to get on board, to understand that this is just really the policy future of this country, which is truly what we believe in. I did want to just mention, though, that when it comes to getting things through on the local level, we're lucky here in Highland Park that there was not a lot of opposition or really any to speak of, but it still has to go through the municipal process. So working with the advocates, getting a hearing before the Board of Health to refer it to the right council committee, and then to have 2 public hearings, once delayed. It's the kind of slow work of municipal government, but it was just really important for Highland Park to make a statement and to do everything that we can to advocate as a governing body, but then join the grassroots coalition in making sure that this bill gets through with leadership like Representative Jayapal. And happy to take any questions, but it really is the work of the grassroots organizers that resulted in this resolution and ultimately the passage of this law, I think.
Thank you so much for sharing your insights, and really, we're really grateful. And one of the exciting things about doing these resolutions processes is then we get to meet great local leaders like you that can become part of our advocacy. And so so we're really thrilled to continue to work with you on this going forward. So thank you so much. So now I'm thrilled to welcome back one of our key partners, Sophia Sepulveda from the Texas Organizing Project, is an affiliate of our coalition partner, Center for Popular Democracy. As we know, healthcare justice has been under attack in Texas, both with the refusal to expand Medicaid, and most recently, the frightening bill that has effectively banned most abortion care in the state. Sophia has been on the front lines in Texas and in her hometown of San Antonio and across the state, fighting for Medicare for all. And I asked her to come and share some insights on reproductive health care and Medicare for all, other issues related to that, as well as their local organizing to build support in Texas for Medicare for all, and particularly in the San Antonio City Council. So welcome, Sophia.
Thank you, Melinda, and thank you, everybody, for being here tonight. As she said, my name is Sophia Sepulveda. I am the statewide healthcare organizer with Texas Organizing Project. And as you've seen on the news, Texas is that set and leading the country into a future where abortion is more difficult to attain, thus putting in peril a lot of birthing people, in particularly low-income people of color, from accessing this medical procedure and ensuring more back-alley abortions are underway. The 6-week abortion ban is an extreme decision made by white, wealthy men in an effort to continue oppressing and dictating birthing people what to do with our bodies, as well as asserting their superiority upon us. And the Supreme Court's silence in the denial in stopping this cruel law is deafening. We can no longer count on them to defend our rights as birthing people. We must act in Congress with a legislation that will protect us from the ever-stretching hand of male white supremacy, and that is Medicare for all. Medicare for all will get rid of the ever-restricting Hyde Amendment, which prevents people enrolling Medicaid and other public programs in most states from using their health insurance to cover abortion care. This amendment disproportionately affects Black, Indigenous, and Latina folks from affording such care. Also, Texas is also attacking our trans community. As a trans woman myself, I have been on the front lines and being very acceptable of what the current legislation is trying to fight. We understand that our community has the least access to health, and we need access to healthcare to get our hormones, even surgery if we wanted to. Healthcare access in the trans community has been problematic, not just because many of us work in low-income jobs where they offer insurances that are costly and with high deductibles. We are unable to use them, where half of our paycheck goes to the insurance, while at the same time we struggle to pay rent or buy food. And this is not just a story for the trans community, y'all. This is a story for many groups, but it is also necessary for us to offset our dysphoria. I have relied before in the Black market to access access my hormones because I didn't have insurance, putting my own healthcare and life at risk to attain the treatment that will allow me to be who I am without having the anxiety that I had before. So let's be clear, these Texas legislatures are preventing trans children from accessing puberty blockers, a medication that once stopped, puberty can continue. And it is also used for cis children who develop too early. So it will affect every children, not just the trans kids. My life, my adolescence would have been better if I would have had access to puberty blockers. My mental health would have been better if I only had access to that medication. So Medicare for All, by saying that it provides access to medically necessary procedures, this would be covered. I have waited 45 years to get my gender confirmation surgery. And even then, I have to get a GoFundMe because the expenses that I will accrue will surpass $5,000. Money that I don't have and that many of us are still struggling to attain. Medicare for All so is not just a cisgender, white, male-oriented legislation. It is a legislation, as the name has, for all. So also the fact that we're doing in our city council has been amazing. We have been fighting really hard to get people who are in community and community advocates when it comes to healthcare elected on the dais. Just this year, we got the first ever Black gay man, openly gay man elected and Texas to city council. His name is Jalen McKee, who is a big healthcare advocate, as well as Terry Castillo. Terry Castillo was a healthcare advocate. She started advocating. She started fighting for Medicare for All with our group Texas Organizing Project under my wing. And now she got elected as a city councilwoman. We have 2 champions elected in city councils who are supporting the Medicare for All resolutions, like everybody said, is the first step in order to really put pressure to our elected officials, like in Texas, Joaquin Castro, who still has not signed into Medicare for All, to actually do it, right? We need to pass them in our cities in order to have that power to confront these people and tell them this is really what our city wants, right? So as people have been saying earlier, the organizing starts locally. We need to not just get people to support the legislation, we need to get fighters who have been advocating alongside us for Medicare for All to be elected into office in order to make our jobs, our lives a little bit easier, despite of the craziness that is going on right now. So we need to have Medicare for All in the United States in order to ensure that our most vulnerable are protected. So we can hold what this country is about, right? And what we continue talking and what is even stated on the Declaration of Independence. We hold this truth to be self-evident that men are created equal, that these are endowed by the Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. It is time we start living by this rule, y'all. It is time for Medicare for All.
Wow. Thank you so much, Sophia. Always, you're always so inspiring, and really grateful for all the incredible work that's happening in Texas. I think it's really important for those of us who lives on the coast and who live in the north to recognize just how much incredible organizing is happening throughout the South and in Texas and elsewhere. So thank you for all that you're doing. And that's really how we're going to win this. So now I'm really honored to welcome Ms. Fari Ghamina Tumpe from our local DC partner, Spaces in Action, which is also an affiliate of Center for Popular Democracy. We've been working closely together to build support for a Medicare for All city council resolution here in DC that will likely be considered very soon. There's been a lot of incredible organizing across sectors, and Ms. Fari has really powerfully shared her family's personal story with city council members to boldly make the case for comprehensive mental health care as part of Medicare for All. So welcome, Ms. Fari.
Thank you so much, Melinda. Can I get everyone to come off mute right now and repeat after me?
I'm sorry, actually, because it's a large meeting, they can't come off mute. Sorry, it's only the speaker. Sorry.
Well, Melinda, can you come off mute with me?
All right, the speakers come off mute.
Okay. So this is the cheer I would love to do with each and every one of you right now. It's no more disparity. Where's your moral clarity? Answer the call, Medicare for all. No more disparities. Where's your moral clarity? Answer the call.
Answer the call.
Medicare
for all.
Medicare for all.
One more time. No more
No more
disparity.
disparity.
More
Where's
disparity.
your moral clarity?
Where's your moral clarity?
Answer the call.
Answer the call.
Medicare for all.
Thank you. Again, I am Fari Ghamina Tumpe. I am a native Washingtonian. I am a multi-generational caregiver for persons with dual diagnosis, co-occurring disorders of both mental illness and substance abuse. I'm a custodial grandmother to two little people with neurodiversities and exceptionalities that have social and emotional learning disorders. Health care for all needs to include mental health care for all. I could go into 100 stories about the pitfalls that my family has suffered in a very broken system of care as it relates to mental health care in DC, but I'll share just one. My daughter is 27 years old. She has schizophrenia. This past April, she had severe bouts of psychosis, kind of right after COVID hit, and she was hospitalized. Upon admission, she tested negative for COVID. Before she was released, she tested positive for COVID. Our hospital system here had partnered with local hotels to house COVID victims that were through the incarceral system and through the mental health system for the CDC guideline 14-day quarantine. Because my daughter was asymptomatic, she was arbitrarily released back into the community, jeopardizing our family and friends after only 9 days. This is yet another gross miscarriage of justice for our most vulnerable citizens dealing with mental health issues. Furthermore, for the past decade, my daughter's bouts of psychosis, which are all nonviolent crimes, have been treated with 3 methods, and 3 methods only: sedations, restraints, and seclusions. This is a young woman who has so much promise, has even said to me, "Mom, I'm so tired of the mental health system throwing me out like I'm nothing but trash." I tried to enroll my daughter into rehabilitation services. We were denied access. Inevitably, my daughter became pregnant again because hypersexuality is one of her most prominent symptoms. And on July the 2nd, 2021, at 1:30 in the morning, in the freezing rain, my daughter delivered my grandson on the ground in the freezing rain. 9 months later, I am still fighting a very broken healthcare system. My home is licensable. I am still trying to get custody of my grandson through our foster care system. There are so many just deplorable domino effects that, because of a lack of a competent and equitable and racially unbiased healthcare system here in DC, our streets are riddled with tent cities, with persons with mental illness who have absolutely no medication management, no treatment plan, no behavioral intervention plans, no housing, no rehabilitation, no vocational rehab. What I would like to also share with you is some of the work that we've been doing here in DC to try to eradicate and mitigate some of the injustices within our entire healthcare system. Far too many residents in the District of Columbia struggle to get affordable healthcare. I know dozens of families. As a mental health advocate and a social justice advocate, I know dozens of families who have to choose between whether or not they will feed their children or buy asthma medication or buy their insulin. The organization that I work with is called Space in Action, and we have aligned ourselves with other powerful organizations in DC, National Nurses United, Metro DCSA, 1199 SEIU, Public Citizen, of course, and for National Healthcare Systems. We have been for months and months hounding the city council and find that our causes are being championed by one of our council members, Christina Henderson, supports Medicare for All. And we have successfully brought on 7 council members, and we need 8. We need just one more council member to pass the Medicare for All resolution in DC. But because of the rising drug prices and the medical debt and folks delaying preventive and critical care, we still lose so many people that fall through the cracks. Our infant mortality rate here is deplorable, and that directly relates and correlates to our poor perinatal healthcare services, our poor mental health services for mothers who have postpartum disorder. So, but our work not only caught the attention of the city council, but many citizens in DC. But the council members that have joined on, we are so proud to announce, are Charles Allen, Anita Bonds, Mary Che, Janice Lewis George, Brianne Nadeau, and Robert C. White. They are all becoming co-introducers of our Medicare for All bill. And just recently, within the past 24 hours, we have gained support from Councilmember Silverman's office, who is not a co-introducer of the bill, but she's willing to support this resolution when it comes up on the agenda. And so our coalition, Medicare for All, it includes family leaders, doctors, nurses, and the DC community. We center the voices of DC families who are often uninsured or underinsured, and we're also having a Medicare for All harvest next month, a festival where we will hear powerful stories, because we know storytelling helps shape and shift the narrative. We will have media there. We will do banner drops here in DC, and we will lift the voices directly impacted for families in DC. And so I thank you for listening to my story. I thank you all for fighting this cause. We will not stop until we win, because health care is a right and not a privilege. Thank you. Thank you so much.
Thank you. Thank you, Fari. We are so honored, and thank you for blessing us and sharing your story and your powerful activism. It's been, I've learned so much working with you, and I'm sure everyone else here from this national audience as well is very inspired by both what you have accomplished, and then the spirit that you bring, and the chants and the poetry. It's just it's so wonderful. So thank you. So now I will like to turn it over to my colleague Brittany Shannahan to share an organizing update and to introduce some of the other local leaders who have achieved some amazing successes over the summer.
Hi, everyone. My name is Brittany Shannahan, and I am the Medicare for All organizer at Public Citizen. My work focuses on supporting activists like you who are working on municipal resolutions. We've had a busy few months since our last webinar. In California, I just learned about this yesterday. In California, Humboldt County activists passed 3 resolutions in Arcata, Blue Lake, and Trinidad. In New Jersey, we saw Asbury Park and Highland Park. Activists in Connecticut won a unanimous resolution in New Haven, one of the main centers of pharmaceutical and insurance industry influence in the country. In Maryland, resolutions were passed in Montgomery County and in the city of Annapolis. On top of all that, we've got more on the way very soon in Coachella and Sacramento in California, in Larimer County, Colorado, in Washington, D.C., and in Gulfport, Florida, just to name a few. In addition to the one-on-one support that we offer to activists, phone calls, jokes, resources, we also have a comprehensive toolkit with all the information you need to pass a resolution in your community. I think, Melinda, if you could drop the link in the chat. Let me share my screen. Share screen, okay. Alrighty. So here's our main toolkit. We have video content from previous webinars. We have some sample resolution language, as well as a step-by-step guide to passing a resolution. Let me pull down so you can see that. I think that's really one of the best things to look at first. You can also, like, if you forget the link, you can just look up Medicare for All resolutions on Google and it should pop up. We have also just put up a guide at the bottom that I'll just pull up here really quickly for activists who've already passed a resolution to bring that resolution with them into a meeting with their member of Congress as an opportunity to ask them to get onto the Medicare for All bill, to encourage them to be a stronger champion if they're already on the bill, and to, if they're already a strong champion, to have that as an opportunity to talk with them and have a conversation about how to push some of their colleagues that may be in nearby districts. Because these meetings are a great way to continue to build the coalition that you would have brought together to pass the resolution in the first place, and to show your representative how much support there is for Medicare for All in their district. Now, if you're joining us for the first time, and if you'd like to see if there are resolutions efforts in our area, you can also check out our map. Melinda can put that in the chat as well. We also, on top of the map, which has the green dots, are past resolutions, and the blue ones are places where people were working on a resolution. In addition to this map where you can zoom in and see what's going on near you, we also have the text for these resolutions linked here, along with any press releases or some of the press coverage we've gotten for some of these resolutions. So, for example, here's the one in Annapolis. That could, it could be really helpful if you are writing your own resolution to look at some of the resolutions that were passed in cities near you, or cities or counties that have a similar profile to yours. So to sign up or join an effort near you, we have the sign up button here. Once you sign up using this form, we will reach out to you with some resources that you can use in order to get started. We can also if there's somebody near you who's working on a resolution, we'll link you up to them. And if not, we'll try and set up a one-on-one where we can talk about what we can do to help you connect with other people like yourself in your area and get a resolution going. If you have questions about the resolutions process, feel free to pop them in the chat and I'll try to reply during the rest of this webinar. Always happy to talk to you all and learn about the work you're doing. But for now, it's time to turn over the mic to organizers who have won resolutions in their communities. Let me stop sharing my screen. Oh, I think there's a button at the top, stop share. Okay, there we go. So the first step is our good friend Heather Stockwell of Rights and Democracy, New Hampshire, here to talk about the resolution in Keene, along with State Representative Amanda Toll. Heather.
Hey, thanks, Brittany. Nice to see you, although not in person. Yeah, I'm the statewide campaign organizer at Rights and Democracy, and I organize around healthcare and the overdose crisis, which two of our top priorities, period, in the state. And just to tell you a little bit about New Hampshire, like none of our delegation, we have 2 senators and 2 Congress people that are not co-sponsors of Medicare for All. So we really needed to strategize about how to build power to actually get them to see that there was the support in our state. And just to give you a little overview about New Hampshire, we're kind of an interesting state. We have 400 state reps and 28 senators, a governor, and 5 people on our executive council. They get paid, at least the state reps get paid $100 a year, and it skews our whole system. So when you hear that we're a blue state, it's not true, because our entire state government is Republican, it's red. So we really had to look at and strategize the best we could. And yeah, so I had a as I said, I work with a lot of different activists all over the state, and somebody approached me from Keene, who was part of another activist group, and he said, you know, this is something I really want to do. He's a retired oncology nurse, and I would love to have had him here tonight, but he's doing his art stuff right now. And so he said, I really want to do this. Let's put together a team, and you know, like there's a start and an end to this. It's not like a longer term kind of campaign. And you know, we also work with PNHP, our Granite State chapter. They're awesome. And so we put together a group of us with one doctor from PNHP, another doctor who we knew from the area, who was actually the former medical director of our local hospital. And that was something that we had strategized with PNHP about, was how do we, you know, we've got a big state, right? There's, you know, hundreds of towns. Where do we begin? You know, it's not always just like the most liberal town, because some of those liberal towns aren't necessarily on our side either. So we also looked a lot at hospital towns, like where the hospitals are in our state. We're seeing a lot of hospitals, especially in rural areas, go under or merge with other larger hospitals. It's kind of a scary time healthcare wise in our state. So that was one of the things we were, so Keene was just sort of the perfect place. But somewhere in there, in our sort of power analysis about like, how do we win, and how do we get our delegation in DC on board, was let's work with state reps. And that's where I met Amanda Toll, and she's been invaluable in helping me really build this campaign and find the state reps that are supportive of the Medicare for All bill or legislation. And she actually testified on it. And I really think is in part part of our success is that what I thought was so great about her testimony was that she really framed it with a feminist perspective, and that committee was leaned heavily female. And so you could see the room change when she spoke and gave her testimony. So I'm going to turn it over to Amanda, who will tell you a little bit about what she was testifying.
Thank you so much, Heather. I'm so grateful for your fierce advocacy, and just really couldn't be more of a pleasure to organize alongside. So as Heather said, my name is Amanda Elizabeth Toll, and I represent Keene at large in the New Hampshire State House. And I ran and I got elected on a feminist platform. And trust me, this is a feminist issue to the core. Countless folks stay in abusive situations because of lack of health care. And it's impossible to have access to good reproductive health care if you don't have access to health care in general. And according to a study referenced by the National Institute of Health, divorce leaves some 65,000 women uninsured each year, with men being far more likely to maintain coverage after their marriages dissolve. And one of my goals as a local rep is, as Heather was saying, like, our federal delegation, like, they actually consider themselves feminists, and they talk about being pro-choice. But I want to really emphasize that there is no reproductive justice without economic justice. Like, they are inherently connected, because people don't make reproductive healthcare decisions in a vacuum. What people have access to plays a really important role. And I can speak to this on a personal level, like what's going on in Texas. Absolutely, like, I am one of the 1 in 4 people in this country who has a uterus who has had an abortion before the age of 40. Like, abortion is a very common procedure. And so we need to be thinking of Roe v. Wade as the floor, not the ceiling. Like, legal abortion is good, but Medicare for all that covers full spectrum reproductive health care, including abortion, is great. And so that's really what we want to go for. And we want to call in these feminists, these people who say that they're pro-choice, and kind of show them this disconnect. Like, there's a disconnect between not supporting healthcare at large and not supporting like a living wage. So, because those two issues are really essential to reproductive justice. And so that is really what I have tried to emphasize. And so when we talk about to these women, because a lot of the time, unfortunately, it's white women who are moderate Democrats who are opposed to Medicare for all. We need to help them bridge this disconnect, and let them know, if we're not supporting healthcare at large, our feminism is really limited to only supporting a certain group of women and not all women, and non-binary folks and queer folks. And that's the type of feminism that we want to be advocating for, one that's progressive, one that's inclusive, and one that's intersectional. And so thank you very much for giving me the honor of speaking here tonight. I'm humbled to be among such incredible heart-centered activists. Thank you.
Thank you so much to Heather and to Representative Toll for joining us and sharing your thoughts and the recipe behind your work. I think it's so empowering to listen, and I couldn't agree with anything you said more. And the work on the opiates crisis that Heather does is also really close to my heart. So next up, I have Cheng Sim Lim and Sean Broadbent of Los Angeles, California. So they are here to speak to their recent success in getting the Los Angeles City Council to pass a resolution in support of California Bill AB 1400, or CalCare, following up on a 2019 resolution for Medicare for all. I know that things are also moving in LA County. Cheng Sim and Sean, how's it going?
Good. This has been amazing testimony this evening, really powerful. So grateful for the opportunity to share with you all. In 2019, Cheng Sim and I were canvassing leads for Medicare for all in Los Angeles, and we both noticed a large gap between the support we saw at the doors versus the lack of co-sponsorship for the bill by certain members of Congress. So we came across this idea of passing a resolution to help bridge this gap between the congressional representative's position and the wide consensus around single payer that we knew existed on the ground. And to get there in LA, we knew we were gonna have to lean into that support in the community. So we went with other folks who had stepped up to lead canvasses locally to propose this idea of getting our neighborhood councils, which are official advisories to the city, to call on their council member to introduce or support a resolution. And I can't emphasize enough how all of this was new to us, like from top to bottom. However, this ended up being very effective, and we shouldn't have been surprised because the neighborhood councils were just as aware as we were of the broad support for Medicare for all. Over a summer of advocacy, we were able to grow that critical support and get a resolution for Medicare for all passed at City Hall. This resolution was able to complement and reinforce our work in the district at doors to get members of Congress to become co-authors, allowing Medicare for all to achieve new levels of support in the House. And then, as you already kind of teased, this year when a state single payer bill was introduced, AB 1400, we knew we had a strategy for communicating support in challenging districts. But this time around, we also knew that we had to help our communities make powerful statements that were informed on health equity during COVID. For that, we turned to our group of activists who were able to pull together tools from LA Public Health and the USC Price Center for Social Innovation, which allowed us to demonstrate the link between lifetimes of being uninsured and being vulnerable to the coronavirus, proposing single-payer universal healthcare as essential for addressing this injustice. So want to toss it off to my partner, Chang Sim, one of many of the amazing activists here in LA that we've gotten to know, but both of us have been partners on this. So Chang Sim.
Thank you so much, Sean, and thank you to all of you here. It's just been amazing listening to what everybody has been doing. So you've heard from Sean how we organize upwards from the neighborhood level to the Los Angeles City Council. So now we are aiming one level up to the county. We are working on getting the Los Angeles County Board of Supervisors to pass a joint resolution for Medicare for All and CalCare, which is California's state single payer plan, modeled on Representative Jayapal's bill in Congress. So LA County has a big footprint. It is the largest county, not just in California, but in the entire country. It is a population of 10 million, which is larger than the population of some states. It's kind of daunting to think of the challenge of getting a resolution passed with such a large municipal entity. And I don't think our group of LA activists would have felt ready to take on the challenge if we hadn't gone through the rigors of twice organizing and succeeding to pass resolutions in the city of Los Angeles. So these prior experiences have enabled us to quickly identify activists who are constituents in each of the 5 county supervisorial districts to be the organizing leads for their district. And as Sean has mentioned, we've also learned to focus our research using publicly available databases to drill down to the neighborhood level to find out all sorts of social data, including health data. So now when we schedule meetings with elected officials, instead of making a pitch that's generically about the benefits of single payer, we are able to go in and cite data from their districts to make a district-specific case for why they should support CalCare. We believe by doing so, we strengthen our pitch and we make it stick better. And for example, just a few weeks ago, we were able to inform some staffers of a supervisor that we met with that a shocking 55% of the constituents in a neighborhood in their district were uninsured. But that, of course, that problem would go away with CalCare. Another thing we've learned that in this time of COVID, more so than during our first resolutions campaign in 2019, people are very receptive when we say that fighting for healthcare for all means fighting for economic and social equality. So, you know, we don't need to be shy about saying that. So for us in Los Angeles, the resolutions campaign is more than a symbolic gesture. The city of Los Angeles sends the largest delegation of elected officials to the California state legislature, in addition to employing lobbyists in the state capitol. So now that the city's resolution in support of CalCare is in the docket, lobbyists for the city will be able to lobby for passage of the bill when it is reintroduced in January of next year. And we're working now, of course, to try to get the lobbyists for the County of Los Angeles to be able to do the same very soon. So we see our resolutions work locally as part and parcel of the larger effort of building political pressure from the bottom up to win CalCare in California. And if the states are laboratories for social change in America, then maybe California, when we can win CalCare, could be the Saskatchewan, for Medicare for all nationally. So we are very grateful to Public Citizen, the California Nurses Association, Healthcare for All Los Angeles, and DSA LA Healthcare Justice Committee for training us and supporting us all the way. Thank you.
Lovely. I always learn so much every time you both join these calls, and I'm so excited for the work ahead. So next, I'm delighted to bring on Chrissy Holt and Phil Latato of Annapolis, Maryland, two excellent organizers and dear friends who can speak to how they got the city of Annapolis to get on board. Welcome.
Thank you, Brittany. Thank you, Melinda. So I'm Chrissy Holt. I'm the state chair of our revolution here in Maryland. And Maryland is one of those states that's smaller than LA County. We actually have 6.2 million people here. So well done, Los Angeles. That's amazing, the work that you're doing over there. So meanwhile, back here in Maryland, Phil and I have been partners in crime as far as this goes for years. When you all introduced the Medicare for All resolutions, we took hold of that here in the state and saw that as a great opportunity. And even though we are a blue state, we actually live in Anne Arundel County, where the city of Annapolis is, and it's a very conservative county. And Maryland is actually a very conservative state. I mean, we did not conservative Democratic state. We have some congressional members that might vote like, Congressman Sarbanes would vote for the Medicare for All bill, but yet won't be vocal, won't advocate with the teams, won't, encourage other people to vote with them. And of course, we have Steny Hoyer here, one of the leaders in the House. And so the way that we've managed ourselves here in Maryland is to build a Maryland Progressive Healthcare Coalition, of which our revolution is a member, Progressive Maryland, DSA, Healthcare is a Human Right, Physicians, PNHP. We all work together on a strategy and work very close with Jayapal's office in terms of targeting our different congressional members to help elevate Medicare for All and all of the healthcare, including expansion. In terms of working on local resolutions, Phil and I divided and conquered here locally with our revolution, Anne Arundel County. And we kept hearing from all of our members that they didn't really understand it. We don't really get Medicare for All. So we organized a town hall from an education perspective. We organized individual meetings. We sat down with people. We brought all of your great toolkit information. We proactively wrote the resolutions for them so that it would be turnkey, and still crickets. We still weren't getting any support. We even would go in, and I don't know if this is true in your world, but in our world, if your agenda or resolution is not on the docket for the night, then you can actually provide 2 to 3 minutes of testimony prior to the council meeting. So we would go monthly and grab the mic and tell stories about the benefits of having a universal healthcare system or a single payer system here in Maryland. And part of that was prompted because we had an Anne Arundel County council member, Allison Pickard, tell us that she didn't think healthcare was a local issue. So we would bring in issues about schools closing, shops closing because they couldn't provide healthcare, all sorts of issues that you all are well aware of. And we would bring 2 or 3 people. So we would bombard the county council meeting and slow things down by educating everybody on Medicare for All. So the real turning point, and we're still struggling in Anne Arundel County, but the real turning point is where I'm going to turn it over to my friend Phil, and he's going to talk about how we got the city of Annapolis to turn inside the pandemic. Because if we couldn't get it done in the honestly, healthcare is a human. Everybody said healthcare is a human right. Women's rights are human rights. Civil rights are human rights. And now is the time for us to be able to get all these resolutions in. Phil?
That's it. Thanks, Chrissy. And yeah, as Chrissy said, we had kind of grown frustrated with our county council here, as our ally on the council wouldn't introduce the resolution without us securing the votes first. And the centrist Democrats on the council wouldn't commit or even talk to us to have a conversation about Medicare for All. So we decided to focus on the Annapolis City Council. Felt like a bit less of a heavy lift. Since Annapolis is a smallish town, about 40,000, and we did have more allies on the city council. So we did have one ally on the city council who had agreed to introduce the resolution. And to be honest, Chrissy and I had gotten kind of impatient because it was further down on his list to do, and he had prioritized the actual legislation over passing this resolution. But To his credit, he did circle back with us about introducing the resolution and getting it passed. So shout out to Alderman Rob Savage for keeping to his word and standing tall and getting this through. I do credit a large part of this resolution passage to a local group, the Caucus of African American Leaders. They allowed us to present and pass a resolution of support through that group. And on that call, 5 or 6 of the 8 voting individuals on the city council, including the mayor, were on the call where we outlined the importance and relevance of single payer to local government and local businesses. So this really helped, I think, pass the resolution 8-0 on the city council. And even the Republican on the council, who often votes against things and can be quite curmudgeonly, as I see it, he even voted for it. Yeah. So a few of the lessons or takeaways kind of we got for is, that having allies in the legislature that you're targeting are crucial. And it kind of highlighted for me how elections do matter, that, I don't personally care much for electoral politics, but much of the work we do as activists won't really matter if we don't have elected officials to pass the legislation. So definitely continue to engage on that. Also, getting support of local groups, organizations, or businesses can be very helpful, was definitely helpful for us, and it can help push legislators to support, as Sean also showed with the neighborhood advisory councils. And as Cheng Sim said, having data specifically for our county was very helpful to show the local impact and why Medicare for All is a local issue, which many local politicians don't seem to see or understand. And as others said, Chrissy said and others, the pandemic showed the need for single payer. If people can't see the need for it after this last year and our current system's inability to meet the challenges of the pandemic, they're probably never going to get it. I'm kind of hoping for a potential cascade effect as more legislatures see other local bodies passing resolutions. They will look potentially out of touch if they don't support. So looking at our neighbor, Prince George's County, which is also the county neighboring Montgomery County, which passed the other resolution. Yeah. So next steps for us here, just to build on this by focusing on getting our county council to pass a resolution and do more outreach locally, get people engaged, which is important since we're so close to DC and can mobilize for direct actions and make a difference in this. And also because, as Christy mentioned, Steny Hoyer, the #2 Democrat, does represent part of our county as well as neighboring Prince George's County, and he currently doesn't support Medicare for All. So yeah, huge thanks to Brittany and Melinda and those who helped provide the resolution templates and tools and framework for us to build upon. That was extremely helpful. And to the Maryland Progressive Healthcare Coalition, because they collaborate, members of that group collaborated and helped us get this done. So hope us talking about our experience here in Annapolis and whatever momentum we get from passing this local resolution helps y'all working in other towns and cities to get resolutions passed. So onward.
Well, can I just also mention that Phil and I did some digging into budgets, and we found that the city of Annapolis sets aside $11 million to cover healthcare, and Anne Arundel County sets aside $107 million on healthcare. So as we start talking to people and we tell them how much we're actually spending on healthcare, all of a sudden people are sort of taking notice that is their tax dollars that are going to a small group of individuals that are getting healthcare when the citizens can't get access.
Thank you so much, Chrissy and Phil, for joining us. It's definitely been a bumpy ride, and I can't believe that you all got to the end. Of course, if anyone was going to do it, it would be you. So for our final speakers tonight, we're sticking to Maryland and bringing in David Glenn and Tasnuva Khan of Montgomery County, Maryland, which had a bit of a similarly bumpy ride. We've had activists trying to crack a very resistant Montgomery County government since the beginning of this campaign, and they finally got there. So David and Tasnuva, please tell us more.
Hey everyone, I'm David Glenn. I'm a nurse here in Montgomery County, and it's true, this was a long struggle, 3-4 years trying to get the attention of the council. There was a time when they were sort of smothering us with love. They would offer us meetings, say that they loved the idea of healthcare for all, but would never actually commit to a resolution with any teeth. So about 1.5 years ago, we decided we would really try to blitz the county council. As many of you know, Montgomery County is a big suburban county right outside of DC, 1.1 million people. We can't compete with LA County, but it's a pretty substantial number. And as Chrissy said, we wanted to make it kind of a turnkey process. So we wanted to have a resolution fully drafted with a powerful coalition behind it. We drafted a resolution, which I've just dropped in the chat, the final version, which foregrounded racial justice and also spoke directly to elements of the county budget and how much the county spends on health insurance for its employees and how much it spends supporting residents of the county who don't have good access to health care. We wanted to speak very directly to the interests of the council members. So we were fortunate to get meetings with Council Member Gabe Albornoz, who became the primary champion on the council. Resolution finally won in July with a vote of 8-0 with 1 abstention. And part of those early conversations, what was helpful in building a relationship with Councilmember Albornoz is we committed our local organizations, we're all part of the Maryland Progressive Healthcare Coalition, to do what we can to help with the COVID pandemic and to fight for testing equity and vaccine equity in Montgomery County. And I think that definitely helped build ties with Councilmember Albornoz and other members of the county. So now I'd like to turn over to my colleague Tasnuva, who's going to talk about how we assembled the local coalition, which I think made a huge difference in making this happen.
Hi, everybody. So I'm Tasnuva, and I am a clinical pharmacist by profession at a local area hospital here, and I'm also a director of a vaccine equity program. So when we collaborated with many local organizations to endorse the Medicare for All resolution, we focused on making sure that there was a number of diverse organizations that supported us, and especially because Montgomery County is a majority minority county, and we really focused on the racial equity, especially in terms of the pandemic, how the highest health disparities have been amongst our minority communities. So we did a lot of outreach to racial equity groups, and then as well as reaching out to local unions. 1199 SEIU is one of them. Several advocacy organizations that are for climate, for health equity. Maryland Progressive Healthcare Coalition is the head organization that our Montgomery County chapter is part of. And again, you have your usual suspects, like the major organizations that are national organizations that support Medicare for All, like Our Revolution, and like as well as a Poor People's Campaign, et cetera. But we were able to have their local chapters endorse this, again, identifying that this is a health equity issue. And even religious organizations also supported these efforts. So again, focusing on the diversity of our coalition partners. Several small business organizations, small business and local businesses also endorsed because, for example, they are paying for healthcare for their employees. And of course, with the Medicare for All system, this would benefit them as a business, and also make sure that their employees are taken care of. And I will just say that we focused on rallying our organizational partners to endorse this resolution for economic justice and health equity. Montgomery County has been a national leader in achieving vaccine equity. I think we're #1 in the nation in terms of how many of our community members in the county are vaccinated. And so with this pandemic, really kind of they changed their tune in making sure that, again, that there's an advancement of health equity for several of our minority communities, especially. And with that, in this pandemic, because it revealed all the disparities that exist in low-income and minority communities, it only made sense for them to support it, not just because all the major organizations that endorsed this resolution and to support it, but as well as the fact that our many diverse communities, religious and racial, diversity also support it. So it was like a no-brainer for our council. Out of 9 council members, 8 of them voted yes, only 1 abstained. So there was no votes. We were also very excited that it wasn't even watered down, which it tends to happen in a lot of county resolutions or city resolutions, where you're not getting specifically what you're asking for in the full bill. But we were very proud of the fact that it stayed true to the original content that we originally submitted to them. And I guess lastly, I would just say that Medicare for All does help make healthcare accessible and equitable for all. And so we're proud to be partners in advancing this crucial bill that will save lives and bring about health equity and economic justice. And David, if I've missed anything, please share some more.
No, that's great. It's really been a privilege to work with all of you, and thanks again to Brittany and Melinda for all the support from Public Citizen. Everything you guys said is true. The toolkits on the website are fantastic resources.
I did actually want to mention one last thing, is that our, in terms of our congressional representatives, 2 of the 3 congressional representatives of Montgomery County have endorsed. And we're still working on that last one. And we're also excited that Senator Van Hollen is also supportive.
Thank you. Thank you so much to all of the incredible organizing and successes that we heard about this evening. And I really, we have gone over time, and I think it's just because it just is a testament to how much is going on all around the country. And what I'm struck with is that this is not our movement. This is the movement of all of you, of all of us who are doing this at the local level in your communities, building this up. And that is how we're going to win. I'm feeling extraordinarily inspired. I always do, but tonight, perhaps even more than ever, really amazed by all of the incredible work that you all have done. And I really want to thank all of our speakers this evening, obviously, especially Representative Jayapal, who took time out of a extraordinarily busy night that I think will probably go all night, given what is happening in Congress right now, to have joined us. Her staff has said that they are extraordinarily committed to this. If there are questions, if we weren't able to answer them, we will go through the chat and we will follow up with you. Also, huge thanks to Councilmember Hersh and to State Representative Amanda Toll for joining us as well, to taking time out of your busy schedules, and really, but all of the incredible local leaders that spoke from coast to coast. We have red, blue, and purple states doing this work, and it's not just those who spoke. We know all of you who are here are committed to this. If you haven't yet signed up your community, please do go to the map. Look and see if you can connect. Put your little town or large city on the map, and we are here to support you, no matter where you are in your activist journey. You can use the toolkit, and we will, really excited to continue to work with all of you. I know we're going to win this. It is a long road. It is a frustrating road, but with all of this incredible organizing, I know we're going to win. So thank you. Thank you to all of you. Have a great evening, and we will see you soon. Bye-bye, everyone.